So welcome to Fortify the Future. This is a World Health Assembly side event supporting the proposed resolution that I hope you all know about by now. I think you're all supporters, and many are originators and sponsors, and many of those very important people who are sponsoring this resolution are in our front row, and you'll hear from them today. The name of our resolution, of course, is to accelerating efforts for preventing micronutrient deficiencies and their consequences, including spina bifida and other neural tube defects, through safe and effective food fortification. So we're delighted to have you join us here tonight, and now I'd like to introduce our first of 6 panels to you. So you'll see we will be effective and concise. So to begin with panel 1, I'd like to introduce them as they take the stage. Vice Minister Jaime Urrego, who is from the government of Colombia. Vice Minister, please have a seat.
Thank you.
Okay, and Dr. Kemal Gatmi, pediatric neurosurgeon, who is going to be translating for the Vice Minister. Dr. Jose Ruales, Minister of Health of Ecuador. Welcome, Your Excellency. And I think she wants to give you a microphone. Thank you. And Dr. Mohammed Radzi Abu Hassan, from the Director General of Health from Malaysia. Welcome all. So thank you all for taking the stage, and we will begin with the remarks of Vice Minister Jaime Urrego, and they will be translated by Dr. Gatmi.
Thank you. Bueno, esta es una ocasión especial para Colombia. Desde hace un par de años comenzamos un viaje para hacer frente a enfermedades prevenibles como son las malformaciones congénitas, incluyendo la espina bífida.
This is a special occasion for Colombia. From 2 years ago, we started a journey to face different preventable conditions such as congenital malformations, including spina bifida.
En este esfuerzo hicimos equipo con la sociedad civil en un claro ejemplo de cómo la diplomacia científica puede generar resultados tangibles en pro de la salud, particularmente de la salud de niños y niñas.
In this effort, we team up with civil society in a clear example on how science diplomacy can generate tangible results in pro of healthcare, particularly in improving the health of children to be born.
El resultado de este viaje es el proyecto de resolución sobre la prevención de las deficiencias de micronutrientes, incluyendo la prevención de la espina bífida y otros defectos del tubo neural, el cual esperamos sea adoptado durante esta Asamblea Mundial de la Salud.
The result of this journey is the proposed resolution on preventing micronutrient deficiency, including prevention of spina bifida and other neural tube defects, which we all expect will be adopted during this World Health Assembly.
Actualmente, según la Organización Mundial de la Salud, 240,000 recién nacidos mueren cada año en las primeras 4 semanas de vida en todo el mundo a causa de anomalías congénitas.
Currently, according to the World Health Organization, 240,000 newborns die every year in the first 4 weeks of life worldwide due to congenital anomalies.
Los trastornos congénitos graves más comunes son las malformaciones cardíacas, los defectos del tubo neural y el síndrome de Down.
The most common congenital disorders are cardiac malformations, neural tube defects, and Down syndrome.
Asimismo, la OMS ha afirmado que es posible prevenir algunas anomalías congénitas, por ejemplo, con medidas preventivas fundamentales como la vacunación, la ingesta suficiente de ácido fólico y yodo por parte de las mujeres en edad fértil, asegurando un aporte suficiente de vitaminas y minerales en la dieta, a través de la fortificación de alimentos básicos o la provisión de suplementos, así como una atención prenatal adecuada.
Likewise, WHO has stated that it's possible to prevent some of these congenital anomalies, for example, with preventative measures such as vaccination, sufficient intake of folic acid and iodine by women in reproductive age, guaranteeing a sufficient supply of vitamins and minerals in the diet through staple food fortification or supplementation, as well as an adequate prenatal health care.
Frente a este panorama, la comunidad científica y la sociedad civil hicieron llamados para que se pueda aprobar una resolución de la OMS para la prevención de la deficiencia de micronutrientes y sus consecuencias, incluida la espina bífida y otros defectos del tubo neural, mediante medidas probadas como la fortificación de alimentos.
With this landscape, the scientific community and civil society made a call to action so a resolution could be approved through the WHO to prevent micronutrient deficiencies and its consequences, including spina bifida, other neural tube defects, through evidence-based measures such as food fortification.
Colombia hizo eco de este llamado y propuso a los Estados miembros de la OMS una resolución cuyo objetivo fuera encontrar mecanismos que pudieran acelerar los esfuerzos en la prevención de las enfermedades congénitas a nivel mundial y a su vez ayudar a los países a alcanzar sus objetivos de desarrollo sostenible para 2030 sobre mortalidad infantil y equidad en salud.
Colombia responded to that call to action, and the state proposed to the member states in the WHO a resolution whose objectives were to find mechanisms to accelerate efforts to prevent congenital malformations worldwide and at the same time to help countries to achieve their sustainable development goals for 2030 about child mortality and health equity.
A este llamado se unieron varios países que copatrocinaron nuestra iniciativa, dentro de los cuales encontramos hoy a Ecuador y a Malasia.
To this call, other states responded, and they are co-sponsoring the initiative, and that includes, who are accompanying us today, Ecuador and Malaysia.
Agradecemos profundamente a la OMS, a sus Estados miembros, pero en especial a la sociedad civil, el impulso a esta resolución.
We deeply thank the WHO, the member states, but especially the civil society in impulsing this resolution.
Para Colombia resulta de gran importancia la promoción de la prevención de las deficiencias de micronutrientes, ya que las intervenciones de este tipo resultan altamente costo efectivas.
To Colombia, it is of great importance promoting the prevention of micronutrient deficiencies, since this type of interventions provide highly cost-effective policies.
Para finalizar, quisiera resaltar que para el Estado colombiano el derecho a la alimentación es una cuestión de salud pública que requiere intervención inmediata en los niveles nacional e internacional.
As a final statement, I would like to highlight that for the Colombian state, the right to access to quality food is a matter of public health that requires immediate intervention on a national and international level.
Lo hemos afirmado antes y lo reafirmamos ahora. La desnutrición es una situación que marca la vida para siempre, por lo tanto, la protección de la niñez se vuelve fundamental. El hambre es una condición inadmisible para un Estado que tiene múltiples alternativas de acción y que son relativamente sencillas para ser ejecutadas.
We have stated this before and we want to restate it today. Malnourishment is a situation that marks a person's life forever. Therefore, protecting children is fundamental. Hunger is an unacceptable condition to a state that has multiple alternatives to take action and that are relatively simple to be executed.
Cualquier política pública debe contar con el apoyo de la comunidad para cruzar zonas focalizadas de hambre y entregar una atención integral.
Every public policy should count on the support of the community to cross focalized zones of hunger and to provide an integral care.
Es por ello que el país tiene como prioridad la seguridad alimentaria para de esta manera garantizar una alimentación adecuada a mujeres en edad de gestación y a los niños y las niñas. Contamos con su apoyo.
This is why Colombia has as a priority food safety. So this way we can guarantee an adequate food supply to women of reproductive age, boys and girls, and we count on your contribution to this. Thank you.
Thank you very much, Minister Orrego, Dr. Gottmey. Thank you so much. And now I call upon Dr. Ruales, Minister of Health of Ecuador.
Thank you very much. We are strongly with this initiative of Colombia, and we are supporting it because we have a history of successful food fortification in our country, no? Before 1968, the prevalence of endemic goiter related with cretinism due to iodine deficiency was 33% at a national level, nationwide. But we had some Andean highland provinces with more than 55% of population with endemic goiter. That was before the obligatory iodization of salt for human consumption law that was published in 1968. After that, in 1999, we had no evidence of new endemic goiter in the country, no? Zero prevalence in 1999 after this iodization of salt. There we had a large-scale food fortification that began in 1995 with the first food fortification plan that started with wheat flour, with iron, thiamine, riboflavin, folic acid, and niacin in 1995. In 1999, the International Council for the Control of Iodine Deficiency Disorders declared that there were no new cases of endemic goiter in the country, and in 2010, the amounts of micronutrients for fortification with iodine, fluor, and in 2011 for iron, vitamin B1, B2, folic acid, and niacin, and vitamin A were reformed and updated. Since there, we have a law that determines the amounts of micronutrients in food fortification. Actually, by 2023, wheat flour and salt are mandatory fortification in the country, and we have milk products that are voluntary fortification for vitamin A. At the same time, we have our strategy project, Ecuador Free of Child Malnutrition, that benefits more than 230,000 pregnant women with supplements of iron, folic acid, and calcium, and 600,000 children under 5 with iron and zinc and vitamin A to complement fortification, no? Because not everybody have access to all the food. The benefits is, as I already said that fortification has been successful. The endemic goiter is no more in the country. Anemia prevalence in pregnant women decreased from 37 to 19% in 2006 after the implementation of the program. And the program has also been successful with 25% reduction in anemia prevalence in children under 5 and 7% reduction in women of childbearing age between 2000 and 2019. And especially we found a relation with fortification of folic acid and in with flour, and a decrease in the rate of registered cases of spina bifida with 0.9 cases per 1,000 live births in 2018 to 0.3 cases in 2021 in just 3 years. Currently, we also have the school breakfast fortification with more than 2 million school-age children through the Ministry of Education. The food products are fortified with iron, calcium, and zinc all over the country. And at the same time, we have some regulations. We have an addition and fortification regulation and technical standard that are mandatory for all food products, labeling for human consumption. And at the same time, we have complementary supplementation with micronutrient supplementation regulation that implements the dosage of micronutrients in different age groups, no? In pregnant women, in lactating women, in children under 5 years old. And the last year we invest about $3.6 million in this program. Finally, we still have some challenges, no? And those challenges are to analyze the mechanism to fortify new products in Ecuador. We are looking at some products like sugar, oil, rice, those that are of higher consumption, and to ensure that the early childhood children receive their iron, zinc, and vitamin A. We focus on households as well as lactating women and pregnant women to receive iron plus folic acid during the first 12 weeks of pregnancy. No? So those are some of our experiences that we want to share with you this afternoon. Thank you very much.
Thank you very much, Dr. Ruales. And now I would like to call upon Dr. Mohammed Radzi Abu Hassan, Director General of Health of Malaysia, to share a few words with us. Thank you.
Malaysia greatly recognizes the importance and the cruciality of prevention and control of micronutrients deficiency via food fortifications. Food fortifications provides an effective solution to the patient's health by aiding vital nutrients to staple foods. Malaysia has embarked on universal salt iodinizations to address iodine deficiency disorders since the year 2000 at the regional level. Implementations of USI at the regional level has shown a significantly improved in the median urinary iodine among school children. Following the success story of the USI, implementations at the regional level in improving iodine status in the population, Malaysia has fully implemented since 2021. The level of iodine added in salt is between 20 to 40 milligram per kilograms as stipulated in the Malaysian Food Act 1983 to achieve the intended outcome of preventing and controlling iodine deficiency disorder among Malaysians. Apart from USI, Malaysia is also currently underway with wheat flour fortifications with irons and folic acid to prevent iron deficiency anemia and neural tube defect among vulnerable groups such as women of reproductive age and children. By ensuring access to these essential nutrients, it can significantly reduce the prevalence of anemia, improve cognitive development, and support the overall health and well-being of the populations. Neural tube defect is one of the most common congenital abnormalities among newborns due to folate deficiency. The congenital malformation is the second most common cause of perinatal death after normally formed macerated stillbirth. The resolutions to accelerate the effort for preventing micronutrients deficiency and their consequences, including spina bifida and other neurotube defects through safe and effective food fortifications, led by Colombia, is what we have been looking forward to. The passing of this World Health Assembly resolution will facilitate member states to strategically plan and strengthen the implementations of food fortification program, ensuring our population receive the intended benefit from fortified foods. Thus, the great support and commitment from all relevant stakeholders, including food manufacturers, industry associations, civil society organizations, and academic institutions, are warranted to help accelerate the implementations of food fortification program in Malaysia. Malaysia is also establishing and strengthening a more comprehensive and standardized monitoring and surveillance system to ensure a more effective and sustainable food fortification program. In conclusions, ladies and gentlemen, this resolution is crucial in providing guidance and support to all the member states in accelerating their food fortification program. Thank you.
Thank you very much. Thank you all. So as we move on to our second panel, just go over, thank you so much. We'll go over the structure for this evening. So this first panel set the context for the whole webinar, and you've heard, or the whole seminar today, and you've heard from the leadership from 3 major countries in the world who have endorsed these programs. The second panel, which we'll be assembling now, will discuss the global crisis of malnutrition and the potential for the impact of food fortification. So while we're assembling that panel, which will be directed by Dr. Ocean Sharp, I'll just tell you more about what we'll hear. Then in the third panel, we'll hear from some of the global voices about how nations have engaged with food fortification and people who are passionate about this. The fourth panel then will be a conversation with representatives from the healthcare and health policy communities. The fifth will share perspectives on the World Health Assembly resolution, and the final panel will focus on action from here forward, tracking the unfinished agenda. And now I would like to pass the podium on to my partner, Saskia.
Thank you, Jill. And it's a real pleasure to be here with you today and to introduce you to the second panel. And in the second panel, as Jill already alluded, we will discuss the issue of global malnutrition, and in particular malnutrition of vitamins and minerals, micronutrients, or hidden hunger, as it's often called, and the role that food fortification can play in combating hidden hunger or micronutrient malnutrition. So it's a true pleasure and honor to introduce you to our panel of experts that will be speaking next. And the first panelist is Dr. Lawrence Haddad. I don't think he requires any introduction, but he is a World Food Prize laureate and the Executive Director of the Global Alliance for Improved Nutrition Gain. Lawrence, welcome. The second panelist is Luz Maria de Regil. She is the head of the multi-sectoral action in the Food Systems Unit at the World Health Organization, and she was one of the initiators for this resolution. And our third panelist is Dr. Marcy Figoda. She's the director of the Scaling Up Nutrition Movement Secretariat, SUN, which is based here in Geneva. So I'm going to join you on stage because we are going to ask you a few questions, and we'd like to ask you to keep your answers brief because you've heard that we have a full program, so bear with us. But I think it's a sign of how this resolution is being supported from different segments of society and from so many different governments, which is great. But I first want to start with you, Lawrence, and could you tell us about the problem of micronutrient malnutrition? How widespread is it, and what are the driving factors behind this?
Thank you, Saskia. What a pleasure to be here, colleagues. Thank you for coming, and thank you for inviting me. It was so inspiring to hear the Vice Minister, the Minister, and the Director General talk about the priority they're giving not just large-scale fortification, but micronutrient malnutrition, the fight against that. It was really inspiring. Unfortunately, most of the people I talk to in my job as the Executive Director of GAIN are not Ministers of Health. They're Ministers of Agriculture and Development and Policy and planning, and they require a lot of convincing that micronutrient malnutrition really is a developmental issue, not just for the individual, but for the community, the family, the nation, the district. So these are my reflections are in that spirit. So first of all, why do we even worry about micronutrient deficits? The first reason to worry about them is the extraordinary number of people that are affected by them. I mean, one of my colleagues, ex-colleagues, always be a colleague, Lynette Neufeld, is an author of a paper in Lancet Global Health just last year that shows, if I get the numbers right, under 5 children worldwide, 56%, I think 56% of under 5s worldwide are deficient in one of 3 key micronutrients, 56%. For non-pregnant women of reproductive age, the number is 69% worldwide. So that's extraordinary, right? Second reason to be worried about micronutrient malnutrition is the deficits, the consequences of the deficits. You'll hear a lot more about them from the other speakers, but they essentially undermine the hardware and the software of the human body. We've heard about neural tube defects. We could talk about the immune system. We could talk about cognitive functions. We could talk about nerve development. We can talk about lots of different things. So that's the first reason. That's the reason why we care about this stuff. Now, what are the drivers? I often talk to lots of people. You know, hunger has really risen on the agenda with COVID and Ukraine and climate. I think it's great that anti-hunger efforts have risen on the agenda, but it feels to me they've come a little bit at the expense of efforts to address micronutrient malnutrition. So we have to work really hard to tell key decision makers in the public sector and the private sector that, yes, dealing with hunger is absolutely essential. It's the first step. But it doesn't deal with hidden hunger, as Saskia said. First of all, look at the numbers. 800 million people are hungry, chronically hungry, worldwide. The estimates that Lynette and her colleagues have produced suggest the number we used to think were micronutrient malnourished is 2 billion. The true number is much higher than that. So the numbers don't match up. But what about the drivers? We say in hunger is caused by 3 things: lack of food, lack of income, and a lack of peace. Well, these are kind of relevant for micronutrient malnutrition. Lack of food, lack of the kinds of food that are rich in nutrients. Most agricultural research and development, most agricultural policy is towards cereals and root crops, not enough to fruits, vegetables, pulses, eggs, dairy. The second reason, income. When incomes drop, people eat less food, but the first thing they do is they eat less food that is nutritious. That's the first thing that goes. So we have to work very hard to make social protection programs much more nutritious food promotive. And the third thing, when war breaks out or conflict breaks out, the first thing that happens again is that diets become very monotonous, very boring, and very unnutritious. So we have to work very hard to make sure that any relief effort doesn't ignore nutrition and nutritious food. But the final point, Saskia, and I will turn it back to you. The thing that makes, I think, micronutrient deficiencies different is the invisibility. Their invisibility. It's not called hidden hunger for nothing. Now, yes, it's very clear when it's a neural tube defect, but for many other micronutrient deficiencies, it's only very clear when it's very far gone and clinical signs are expressed. So what does that mean? It means parents don't know their kids are malnourished with micronutrient malnutrition. It means communities don't know, and it means that policymakers often don't realize just how pernicious and undermining micronutrient malnutrition is. So this is why I'm so excited about this resolution. It's not just good for large-scale food fortification, it's good for micronutrient malnutrition, making the invisible visible. Thank you.
Thank you. As usual, very inspiring words, and that's exactly why we are also excited to be here this week. I now would like to ask Luzma, could you tell us about the impact of micronutrient malnutrition, about the role of food fortification to address micronutrient malnutrition, and also where does food fortification fit among other food and health interventions that we have available to address micronutrient deficiencies? And we heard that already from some of the ministers who were talking about food fortification in the context of broader programs. Over to you.
Thank you. And first, thank you to Colombia, Ecuador, Malaysia for co-sponsoring along with other countries this resolution. I truly hope that it will make a change. Fortification is one of the options to improve micronutrient intake. As Lauren said, diets are often scarce in most of the countries in nutrients. Hunger is growing, and especially if there are shocks, they grow and the diets become monotonous. So fortification is a way of adding a small amount of vitamins and minerals that can be supplied in a constant basis to people through the regular diet without making dramatic changes on the diets. And that leads to higher nutrient intake. So fortification, I mean, we have heard very successful cases, has been successful with salt iodization in many countries. Many of us and many young people may not think about iodized salt. That's something different. It's just given for granted. It's part of the regular diet. And certainly it has achieved an important health impact. In the case of iron and folic acid, we know that the intake is insufficient, and particularly among women of reproductive age. So fortification aims at delivering higher levels of folic acid, for example, iron, zinc, and other nutrients that are deficient in the diet. Fortification is not the only solution, and we need to be clear about it. It's a very important solution, but we need to ensure that, as was mentioned by the Ecuador government, there is a comprehensive policy to address micronutrient deficiencies. Fortification is one of them, delivered through the food system, but also ensuring that pregnant women have access to iron and folic acid supplements, are in some countries to iron, folic acids, and supplements, plus other micronutrients depending on the local policy. We need to ensure that. We need to ensure that there is access to a diet. Diets are becoming unaffordable in many countries. So it's important that we keep fighting, not only for fortification, but access to affordable diets that can prevent micronutrient deficiencies, but also the provision of unhealthy dietary ingredients. So that's overall. I mean, I would say that that's the big picture. So healthy diet, supplementation, fortification, all those are complementary interventions that ensure that there is an adequate nutritional intake among the different age groups.
Thank you, Luz. And that's a very clear picture emerging here. And I would like now to ask the final panelists, Marcia, can you tell us about the impact of micronutrient malnutrition, particularly in low and middle income countries? We've heard a bit about that already by Lawrence, but can you elaborate on that a bit more? Why are we doing this?
Thank you. It's a pleasure to be here, and it is fantastic to also see representatives of the Scaling Up Nutrition movement, including ministers of health. The Scaling Up Nutrition movement, for those who don't know it, came out of the 2008 food crisis, the influential Lancet series about the importance of the first 1,000 days, and the recognition of the need to have a broad-based approach to tackle malnutrition. So from the start in 2010, we now count 65 countries which, under government leadership, have committed to scale up nutrition, working across sectors and across society. The consequences of micronutrient deficiencies are huge and varied, and colleagues have spoken about this. A huge burden on affected people, their families, society, including weakened immune systems, susceptibility to infection, health costs, a negative lost human capital, and reduced economic productivity. The impacts can be long-term, even irreversible, and can include preterm births and birth defects that we will hear about more going forward. There are, of course, economic dimensions, and while the data on this do not seem to be current or particularly strong, in some countries, 2-3% or even more of GDP may be lost to micronutrient deficiencies. Micronutrient deficiencies now have economic impacts later. In terms of low and middle income countries, there can be additional challenges. The global food and nutrition crisis has created new vulnerabilities, higher levels of poverty, and reduced people's ability to access a healthy diet. The complementary interventions that Luz just spoke about may not be readily available, particularly for people in remote and fragile contexts where they may be more susceptible, likely are more susceptible to micronutrient deficiencies. The costs of treating them can put pressure on already strained health systems. There are gender dynamics. In some countries, even where health services are available, the gender dynamics may mean that women and girls may have less access to services. And then finally, in countries where there is significant stunting and wasting, micronutrient malnutrition, this invisible hunger, as Lawrence has put it, may not get the attention it deserves, despite the incredible impacts that addressing it and food fortification can have. We know what needs to be done. We know that it needs to be multi-sectoral. And colleagues, including yourself, have talked about successful programs being built on multi-sectoral foundations, including government, private sector, civil society, academia, and so forth. There are opportunities, and I do want to focus on that. In the 65 Sun countries, 25 are planning within the next period of time to renew or update their national nutrition plans. And this is a fantastic moment to include or expand and strengthen mandatory food fortification programs, making them a key component of nutrition strategies. Of course, and colleagues spoke about this in the first panel, strong legislative and regulatory frameworks and monitoring and enforcement of this is key. The evidence is clear. Food fortification is incredibly cost effective and really, and we've known this for years, for decades, one of the best bets in nutrition and development overall.
Thank you, and that's absolutely true. I have one final question for the three of you, and I would like you to answer this in one sentence or 1 minute even, because we are all here celebrating this WHA resolution on food fortification, which I think can help to drive a broader micronutrient agenda as well. I would like to know from each of you, why that WHA food fortification resolution is so important and what you hope it will accomplish. So maybe I will start now with you, Marcy, and then
Sure,
the
thank
other
you.
order.
I have 3 hopes. The first hope is that the passage of the resolution will bring new energy and excitement to a proven approach to ending micronutrient deficiency. And I think it's amazing that something that is more than 100 years old is as relevant and pertinent as ever. Secondly, that this resolution helps address the particular challenges that women and girls face, including adolescent girls and non-pregnant women who may not readily access health services. And then thirdly, that we begin to see this, addressing micronutrient deficiencies, not only as a health issue, but as a development and economic opportunity, that it's really about people and their potential and thriving societies.
Luz?
I think that there is already an intrinsic value in this resolution, and is that it brings together communities that traditionally don't talk to each other. There are surgeons that have a very particular approach. Let's solve the problem, for example. People in nutrition, let's design a program. We are talking to each other. We are here talking about how we can move this forward. I believe that we are not starting from zero. That's why this resolution is about accelerating efforts. There is experience in fortification. There are countries that have proven that can be done. In different income countries, it has proven that can be done. There are policies that allow the implementation of fortification, and there are different entry points like a revision of plans. The pathways of the Food System Summit also include fortification. Most of the countries include fortification as part of their pathways. So I do hope that what it will do is to help the different communities to think that it's possible to accelerate efforts. Of course, we need to be able to talk to more sectors. Financing is very important. Fortification is underfinanced, and although it's very cost effective, it should not be understood that it's cheap. We need to do good programs for fortification to ensure that people receive the best nutrition that they can. I will stop here.
Thank you. Yeah, and I fully support your comment that this is a unique resolution and that it brought communities together. And I really think we will hear more from the neurosurgeons and their passion of why they are so supportive of this resolution later on. Over to you, Lawrence, for this question.
Thank you, Saskia. I couldn't agree more with what Marcy and Luz have said. I hope this resolution will go deep and it will go wide. I hope it'll go deep and create an opportunity for all of us to become monomaniacs on a mission to make sure large-scale food fortification has higher coverage, has higher quality. But, colleagues, it's going to take time. This resolution is an opening. It's an opportunity. We must seize the opportunity. We must make it happen. But I also want this resolution to go wide. What do I mean by that? Again, our mission is to make, I have to think about what our mission is. Our mission is to make healthier diets more accessible to everyone, especially the most vulnerable. So again, we work, 20-25% of our portfolio is on large-scale food fortification. But the rest is about supporting small and medium enterprises, working with policy folks, working on the demand side, working in value chains. There's lots of things we can do to make micronutrient malnutrition history. So I hope this resolution not only raises the profile and reduces the invisibility of large-scale food fortification, but raises the profile of the terrible thing that micronutrient malnutrition is. I flew here today. Micronutrients are small but powerful, and you notice them when they're not around. So micronutrients are like the rivets that hold the plane together that I flew over in, right? They're like the roots that hold these trees up. You don't see them, but if they weren't there, everything would collapse. And they're really like the fabric that is interwoven into this tapestry of life that we are all about. So we must make sure that micronutrients are accessible to all people, especially the most vulnerable. And this resolution is going to be a big step forward. Thank you.
Amen. Thank you so much, Marcy and Lawrence and Luz, for your contributions. I would like to now go over to the next panel, which is, as what you heard, a new panel of 3 more government representatives. We've heard about Colombia, Ecuador, and Malaysia, who were really championing this resolution, but we have some very strong supporters and experts from other countries as well. We will hear from them now. So I would like to call on the stage Her Excellency Dr. Lia Tedessi. She's the Minister of Health in Ethiopia. Welcome. Dr. Mohammed Islam Bulbul. He is the Director of the National Nutrition Council at the Ministry of Health in Bangladesh.
Thank you.
And Assistant Secretary Mylene Beltran, who is at the Department of Health at the Public Health Services team at the Government of the Philippines. Now, each of you have 3 minutes to talk about the experiences with large-scale food fortification in your country and the role that this resolution could play there. And I would first like to ask Dr. Tedessi to talk about the situation in your country, Ethiopia. Over.
Thank you. Thank you very much for the opportunity, and I would like to start by expressing my sincere appreciation to all who worked hard to reach to this stage in terms of the resolution which will be passed at this WHA. A lot has been said in terms of the need for food fortification for a country like ours with very high issues of malnutrition. Of course, stunting, wasting, but also really significant amount of micronutrient deficiency, with a recent study even showing 66% of any micronutrient deficiency in women of reproductive age. Although we have been intervening a lot in terms of nutrition interventions like iron folic supplementation and other efforts, the progress has not been really much. And we have been advocating in terms of course, the iodine fortification, the impact of it has been hugely significant for us, similarly as other countries have mentioned. And beyond just the deficiency, the impact of it we are seeing is we are one of the countries with highest rate of neural tube defects, reaching up to even 130 per 10,000, which is, as you can imagine, very high. So we have been advocating to work on mandatory food fortification, considering, of course, the different methods that can be used for a community like ours with a very high rural population. So promoting the concept of double fortification of salt, but also others like wheat and other cereals and oil has been, we have been promoting that. And a year ago, around June 2022, it was actually soon after the last meeting WHA that we had, our council, which leads this, which is led by the Ministry of Trade and Regional Integration, but we are members of it with different sectors represented. We had presented the mandatory food fortification to be passed, so it was endorsed. So now, as a country, the council has endorsed mandatory fortification. But the challenge is definitely what we do after this. And of course, the resolution coming out like this would bring that momentum to support us as a country. But the challenge would be going forward after we have that enacted. We need working really on the capacity, and especially for, as I said, for a country like ours, not only on the large-scale fortifications, but also what do we do on the local millers as well, because we have large number of local millers. So that's why we are also trying to advocate more for the double fortification, but still using the entry point for some technology, low-cost technology we have seen in some countries experience using dosifiers for local millers, maybe something to be considered in terms of collectively looking at how we move forward. And then, of course, the last issue is the regulatory issue and of enforcement, really, that requires support in terms of capacity as we move forward. So we are trying to work on those issues. Thank you.
Thank you very much. Thank you very much for your leadership and your championship for nutrition, because I know you are a big supporter for nutrition. And thank you very much for laying out also the challenges that are ahead of us once this resolution passes. And we will come back to that as well later on in the program. So over to Dr. Bulbul for the situation in Bangladesh with regard to large-scale food fortification. Over.
Thank you, Saskia. It is really a great honor for me to represent Bangladesh. As you know that we have a history of almost more than 40 years of fortification. We started with salt, then well, now we are going to make it rice and flour. So as Lawrence said, that this is invisible, and I always say it, silent killer, that is micronutrient deficiency. Generally, people usually used to see two dimensions of the malnutrition, under and over, but micronutrient deficiency is really a matter of, making understand to the people that this is a biggest killer. Our government is really working hard to make it more prominent and making this available to the people. There are challenges, as they mentioned, that we have some challenges, but still we have good successes because it is really cost effective, as well as it works well for the people who are really suffering for deficit. I can memorize that when, years ago, I see in television, we said, night blind people. We see the, goiter people, but nowadays it absolutely omitted. So this is a great success. Another way I can say that how some sort of resolution is important for us. So if you say about solidarity, if you say about engagement, and really multi-sectoral approach, so all these things might be bring through this resolution. Another one is guidance to the member states. The member states really will get proper guidance that how they will actually move forward with the fortification. So this sort of resolution will really help the member state that how we'll move forward. Finally, I mean multi-country approach. Now it's like one sort of, I mean, very sporadic way. So after having passing some sort of resolution regarding the fortification, it will, I mean, make the policymakers to think, move forward, I mean, with a collaborative way. Finally, I hope that we will all work together and move forward, especially our government is thankful to our partners, especially development partners, those who very closely works to improve the micronutrient deficiency. So we are really grateful to them, and we are, I mean, we convey our thanks to all our development partners. Thank you so much.
Thank you, Dr. Bulbu and Donawat. And I would like now to hand over to the Assistant Secretary Beltran, Executive Director of the National Nutrition Council in the Philippines.
Hello, thank you very much, and good evening, everyone. Thank you very much for this opportunity of new learnings and of the fellowship. So for context, the latest data from our national nutrition surveys show that micronutrient malnutrition deficiencies is still a big public health problem for the Philippines, and this is impacting on healthcare costs, on productivity, as well as educational achievements, especially among children. So we are supporting this resolution because we firmly believe that food fortification of commonly consumed food and products would be the best strategy to increase the micronutrient intake of the population, particularly those at risk, including women as well as children. And thus, through food fortification, we hope to eliminate the problem of micronutrient malnutrition. We have, in fact, existing laws, and these are major laws that would aim to intensify food fortification efforts. Of course, we have the Salt Iodization Act, which would mandate fortification of salt in the country. And then we have the most, also another important law, which is the Food Fortification Law, which mandates the fortification with vitamin A and or iron for rice, sugar, cooking oil, as well as wheat flour. And then, of course, we also have the Consumer Act of the Philippines, which would mandate the Department of Health to establish standards for identifying and to ensure quality of food products. We have also declared through an executive order that November 7th of each year is a food fortification day. So while these have gained ground, as mentioned by my colleagues here, there are challenges that we're facing. And one of which would be there's a need for greater political will to ensure that this becomes a priority that the government should address. Well, in fact, the current administration has started off by reconstituting the Interagency Task Force for Zero Hunger, and that we hope this would also gain a lot of ground. This would then ensure that initiatives, programs, policies will be cascaded down to the communities and ensure that nutrition programs are delivered there. To this end, we the adoption of the resolution will really strengthen and strategically revitalize all these efforts for the country. And then we know that this would really push for food fortification program that would compensate for the loss of nutrients due to processing and storage of food, and ultimately in the promotion of optimal health, especially among at-risk population. Well, we are specifically advocating folic acid supplementation. As evidenced by studies, folic acid fortification has been considered as a complementary measure to supplementation. We do, however, request that the resolution further highlight the following. One, increase support for research on folic acid fortification of staple food to increase public access to fortified foods with folic acid. And then the other one is to revisit policies for multi-sectoral as well as public-private partnerships to realize fortification efforts. We urge the inclusion of nutrition and food security bodies, as well as those agencies involved in the supply chain management. And this multi-sectoral strategy, as well, and a whole of society approach, is fundamental for the attainment of our sustained food fortification efforts. We believe that by implementing these measures, countries can make significant strides in addressing micronutrient deficiencies, promoting health and fostering economic development. So thank you very much for this opportunity.
Thank you very much. And we're going to remember November 7 as the National Day of Food Fortification. Thank you very much to this fantastic panel, and thank you for your leadership and your work in food fortification. I will now hand over back to Gail for the fourth panel. Over to you.
Thank you very much, Saskia. And as our panel comes on the stage, Dr. Gottme, Dr. Jakob, Dr. Caceres, let me introduce them to you. So these are voices from the healthcare community, and they all work through the Global Alliance for Prevention of Spina Bifida F, which is a combined partnership initiative of the G4 Alliance and the International Society of Pediatric Neurosurgeons. And I just want to make a shout out to Dr. Jeff Blount, who's taking humbly a picture of the people on the stage, but he's the co-founder of that organization. So welcome to all of you. From your left to right are Dr. Jakob Ahmed, who is the country director in Ethiopia for Reach Another Foundation. In the middle is Dr. Adrian Caceres, pediatric neurosurgeon in Costa Rica, and Dr. Kamel Gottme, MD, PhD, who is both a surgeon and a scientist in this area. So let's get started. And I think we were going to start with you, Dr. Caceres, in the middle. You're from Costa Rica. You're one of 3 pediatric neurosurgeons who treat every single child in the country who has a problem. Just flip it up to on. So tell us why you're interested in the resolution and in spina bifida. Thank you.
So I would like to start by thanking all of you for your continued interest in promoting a better health for everyone through nutrition. And today I would like to make a case for folate fortification based on the following premises. Fortifying with folate is effective, and we know that because it not only decreases the number of patients who are born with spina bifida, but now we have the evidence that it also decreases the severity on those patients who are still born with this disease. It is economically viable, and it should be part of every sustainable development policy in the world. It is safe and is ethically mandatory. It's been 30 years since a study was published by the British Council that proved that fortifying micronutrients could prevent spina bifida. And therefore, more than 12 million individuals worldwide have been born with this disease that could have been prevented, largely by fortifying the micronutrients. So that is a very big number. We're talking about 300,000 patients worldwide annually. And this is the most severe congenital disease that's compatible with life, even if untreated. So we know it is safe because 25-year longitudinal studies have proven that it has no correlation whatsoever with the so-quoted Alzheimer's disease, cancer, HDAD, and autism. So we know it's safe by now. It's been 25 years of data. And we also know that the children who are born now that still get spina bifida are able to walk because most of them will have lesions that are less severe. And not only that, we know also that there is a decreased infant mortality rate whenever you fortify. So you are hitting several factors that greatly affect the quality of life of these children. And once you are able to establish that fortifying is not only safe, but economically viable, because once you convince a miller that by investing $5 per ton of flour, you're able to cover this huge range of population. I will just quote something for you to remember, and it is, when President Roosevelt actually promoted the March of Dimes to take polio away, this was one of the most efficient public health measures, and we were able to get rid of polio. COVID came by, and we were able to get rid of COVID in a 2-year term. Now we have a vaccine that is extremely cheap to prevent an epidemic of infantile paralysis, which is called spina bifida. So I would like you all to hang on to that idea. This is not only viable, but it's also very, very economically viable. I would just like to conclude for all of you that in your dossiers, you will see this graph. This graph shows how in Costa Rica, in 1997, we started fortifying wheat, then corn, then rice, and then dairy, and how we had a 67% drop in the number of cases of spina bifida. And this was not just an observational effect. It has been proven for the last 25 years. So this is solid data that has been recently published, and that we can make available for any one of you who's interested. So please join us in this quest for a better life for our children. Thank you.
Thank you very, very much, Dr. Casero. Very compelling data from Costa Rica. And now, Dr. Ahmed, please tell us about the situation in Ethiopia and what Reach Another Foundation is doing. Thank you, Dr. Ahmed.
Thank you. Thank you very much. I think most of the policy-related facts are mentioned by my minister. So I will give you why we are, as Reach Another Foundation, advocating for fortification. So we've been in Ethiopia, a health system as Reach Another Foundation for 14 years. And we have supported the operation of more than 10,000 children. So in this journey, we've learned 2 major lessons. So the first one is treatment in low and middle income country is expensive. So training of neurosurgeons, like in the country, our country is second biggest country in Africa. We have more than 120 million people. We have less than 100 neurosurgeons. So you can imagine taking that precious time of neurosurgeon to operate or to spend in the OR in a preventable health problem. So we see treatment is expensive because we don't have enough neurosurgeon, supplies, equipment, infrastructure, all those things, even though the surgery is straightforward, maybe easiest neurosurgery intervention, but it's all in all expensive. After the surgery, those children, the treatment starts after the surgery. It is like a lifelong aftercare. You all know that clinical part. And the aftercare become not only expensive, we've seen it's also complicated. Yeah. You have to bring a bunch of professionals together to create a multidisciplinary team and then take the care for life, which is so complicated, especially in a country where there is a limited number of professionals, very limited number of equipment, very limited number of infrastructure. So we, as Reach Another Foundation, learned this in this process, and we start to shout out about prevention efforts since, I think, 2015, 2016. So now we end up with this resolution. As Dr. clearly stated it, this prevention is, even though it may not be free, but cheap, safe, and also effective. It's been tested in many, many countries.
Right.
So now Ethiopia is taking bold, visible measure to prevent this. This one is like, for us, it's like highlight of the year. So that's why we are advocating this resolution, and I personally ask everyone to join hand to prevent this preventable problem that takes a lot of resource, a lot of time, a lot of complication for healthcare system in most of the countries. Thank you very much.
Thank you very much, Dr. Ahmed. That's a tremendous contribution that Reach Another has made, operating on 10,000 affected infants. And now, Dr. Gottman, tell us, as an MD, a pediatric neurosurgeon who takes care of these patients, but also as a PhD who studies this problem and the basic science of it, tell us how you got involved in advocacy and where you think it's going.
Thank you, Dr. Rousseau. I want to say that this resolution helps bridge not the gap, but the chasm between what we know and what we actually do, between knowledge and action. We've had robust evidence from the last 3 decades that, as our fellow speakers have stated, this is one of the most impactful public health policies. And having together civil society, scientific community, member states, and WHO promoting this is a great start. It's not the end of the process. After the resolution is passed, hopefully by the end of this World Health Assembly, we need to work on implementation in help countries, especially in low and middle income countries, to adopt the policy effectively and safely. We need to work together for surveillance and monitoring of this policy, and also for long-term sustainability. And as civil society, we are happy to help all countries to achieve that, including all of the organizations that are supporting the micronutrient movement. And the countries are not going to be alone. We will continue in integrating that. And one of the reasons, going back to your question, Gail, is providing the best of our care to our patients, we can impact their lives and their families. But these policies will impact on a more systemic way. And that's something that provides meaning to a neurosurgical career. Right. And I also wanted to state that advocating for primary prevention by no means imply dismissing the complementary measures that we had mentioned. We need to continue working on diet diversification. We need to continue promoting supplementation, and we need to incorporate fortification, that the countries that already have a policy in place can extend the reach of that measures. They can increase they can implement the policy with better fidelity, and they can monitor and guarantee the long-term sustainability. And the second thing is that individuals and families living with congenital malformations such as neural tube defects, spina bifida, hydrocephalus, heart congenital malformations, cleft and lead palate, they are already living with that. And unfortunately, we cannot prevent all of the cases because it's multifactorial. So that doesn't mean that we're going to decrease the care that we provide to them with the best scientific rigor, with a humane care and a person-centered care. Quite the opposite. They inspire us. And reorienting efforts to those cases that cannot be prevented will help us to provide a better care and a better aftercare, and more conditions for make their life fulfilling and with the highest quality of life.
Great. Thank you. Lightning round. One sentence. And the question is going to be, what are you or your organization or your country going to do in the next year, assuming that the resolution passes? What do you think is among the top things that you should do in the next year in your country to be able to work toward the implementation phase of this resolution? One sentence. Kemal got me. You start.
Assess the regulatory status of fortification policies, establish a need assessment, and help countries to promulgate, enact, enforce, and implement in real-life scenarios fortification policies.
Great, thank you. Dr. Caceres, Costa Rica.
We will spread the word that even in a small country such as Costa Rica, you can make a big impact that will go worldwide. Just by spending $5 per ton, you can prevent $300,000 per lifetime on each of these patients.
Yeah, that's very compelling. And finally, Dr. Ahmed.
So we will be
Ethiopia.
working with the government, the federal government. We have this Fortification Alliance, was part of that alliance, and help the government to translate the resolution into action. It's already started back.
Great.
So
That's wonderful. We look forward to it. Thank you all. We really appreciated your comment. Okay, and now we're going to move on to panel number 5. So if we could help the members of panel number 5 come to the stage, and I will introduce you as they do. Thank you so much for coming up. So we have Dr. Sylvia Rosen, who is the Secretary General of the International Federation for Spina Bifida and Hydrocephalus. And she's accompanied by Dr. Papacha Alkingenka, who's a board member of the Turkish Spina Bifida Association. And finally, Dr. Vilma Tyler, who is a senior advisor of school-age children, adolescents, and women, nutrition and child development of the program group of UNICEF. Welcome, all of you distinguished panelists. This panel will be speaking about how and why this resolution is so important to their key fields of advocacy in disability rights and in human rights. So I have a question for all 3 panelists. What is the connection between this WHA food fortification resolution that we all anticipate and disability rights? I'm going to start with you, Dr. Rosen.
Thank you so much. Let's put a human face to it. And first, compliments, because by your presence here today, we don't need to convince you. You are already committed to make this whole resolution successful from the starting point to its implementation. So thank you for being here, and thank you for continuing that journey forward. So as International Federation, we represent, in fact, a large community of persons with spina bifida and hydrocephalus and their families, and they are impacted by this resolution. And there is a global momentum for large-scale food fortification, and that has already been mentioned. But if we look at the discourse of this whole momentum, it is promising, but it is also mixed, because we need to take into account the prevention from a disability rights perspective. Because when we advocate for prevention, inevitably, that includes also discussing neurotube defects and spina bifida, amongst others. And that carries the risks of harm, of stigma, and unintended consequences to reinforce stereotypes. And these are, of course, complex topics, but the World Health Assembly resolution covers those 3 policies: the disability, nutrition, and health, and therefore very promising. Success lays in the partnerships. We already have heard that. We already have heard good examples, the public, the private, the civil partnerships. But let me share with you what is a very promising interaction. That is the interaction with people who have the condition. Because then you move away from something that is very technical and abstract and imposed from above to something that is humane and a joint action to global health. That's why it's so strong to have the spina bifida community here also represented. And I want to ask Papacha to continue on that note.
Wonderful, thank you.
Yes,
Yes.
it works.
Yes.
Hi, you have been hearing this tongue-twisting, funny-sounding word spina bifida all day. And I'm here as the voice of that group because I have spina bifida. I am a member of the Turkish Spina Bifida Association and also a board member at the International Federation for Spina Bifida and Hydrocephalus. I would very briefly talk about the situation in Turkey, just to give you an idea what it is like there. So 4 out of 1,000 live births have some sort of neural tube defect in Turkey, which means the psychological, social, medical, and economic repercussions are really huge. This also means that we need lifelong access to multidisciplinary care, support, and societal inclusion to live our lives in dignity and to the best of our capacity. A well-designed and properly implemented fortification policy is a way to achieve this, and I'm really from a community that would have benefited from a resolution like this if it were in place at the time I was little or just not born. But I just really would like to quickly underline that this is only half of the struggle for us, because both the Turkish Spina Bifida Association and the International Federation have a dual mission. You can actually read it over there, but I'll just say it for you. So one is to prevent NTDs, and the other is to improve the quality of life of persons with spina bifida and hydrocephalus. And it is always tricky to balance these two. As lifelong advocates, this resolution is important to me and to my global community because it offers a feasible and easily applicable option. And for conditions like spina bifida, food fortification is definitely essential from a preventive point of view. Nevertheless, we should make sure that in our prevention efforts, we are not saying that only certain lives are worth living. We should definitely not say that. Having spina bifida is considered a disability, but my disability is not a result of me having spina bifida or my mom not taking enough folic acid. I am disabled because the society that I live in has not yet made the effort to make it accessible for me. Like, I need someone to help me up the stairs, for instance. It's not, I mean, I like her, but I don't need to just on her arm all the time. And an advocacy campaign that focuses solely on prevention is risky, is what I'm trying to say. And putting emphasis on one geography, gender, or ability group also hides the actual state of things and gives a false image idea. There is a need to look at this from a context of the disability rights then. In order to have it, this is just the start of it obviously, but in order to have it properly implemented, every relevant stakeholder should be at the decision-making table, making a valuable contribution. And these outcomes, like healthier, more resilient, and economically sound public health outcomes, are not possible without being inclusive. So what happens is we need to have the ripple effect. People form national associations because they would like their voices to be heard. And these national associations represent their members within their countries, initiating dialogue with the necessary authorities. And then the International Federation, bodies like International Federation, just make these efforts global, and we learn from our best practices. So both national organizations and international federations like ours can play a crucial role in ensuring that the implementation of this resolution does not leave out the needs, requirements, and advocacy of persons with spina bifida. So I really think that this could accelerate our efforts, and I'm coming to an end of my speech. Sorry about that. Okay. So co-producing the best way possible forward is key. We need to be at that table. We need to be included. Otherwise, it's just a very nice piece of paper, but it doesn't have the effect that it needs to have. We are the ones with the lived experience, so please count us in. Don't disregard us, is what I'd like to say. I'm here to be the voice of my community, and we are only stronger if we join forces. We are only stronger if only decisions are taken with our inclusion. Nothing for us without us. Thank you so much.
Thank you so much. Thank you so much, Dr. Alkan, and I will come back to you for a final word in our lightning round. Next, Vilma Tyler, UNICEF. Thank you for joining us tonight.
Thank you. As UNICEF, We are the voice of children and women. And therefore, we advocate for any intervention that affects their lives. So, large-scale food fortification and this resolution is now more than ever really becoming critical to accelerate action on the ground. We see the backdrop of nutrition is changing, and there are new forces driving, both in a positive and in a negative way, the nutrition situation of children and women around the world. Globalization and urbanization have changed food availability, environments, and food practices. Millions of families have left the countryside and moved to cities, leaving behind traditional diets for processed foods that are frequently very poor in essential nutrients. Socioeconomic inequities are increasing in most parts of the world, and many families are changing the way they eat or feed their children because of poverty and the rising cost of healthy diets. The evolving face of malnutrition demands a new global response, one that delivers diets, services, and practices that support good nutrition at every stage of life, while sustaining nutrition responsive development for all children, adolescents, and women. UNICEF works to improve the quality of women and children's foods, food environments, and food practices. The evidence is strong that food fortification has led to a substantial increase in the availability of some essential nutrients, including iodine, iron, folate, and vitamin A in several regions. Its impact on nutrition and functional outcomes has been confirmed. So UNICEF in 2020 has developed a strategy, nutrition strategy, what includes large-scale food fortification as a priority action to ensure better diets for children through actions in the food supply chain. UNICEF is very well positioned to apply the global lessons learned on fortification, particularly in relation to government engagement, partnership convening, policy formulation, program design, and public communication. With UNICEF's presence in more than 160 countries, and with the long-standing relationships with governments and national at national and subnational level, we can partner with them to support this important intervention. We have expertise and authority in convening on the ground partners and facilitating coordination and integration. It is well suited to position fortification within the broader nutrition, health, development strategy, and advocating for the integration of fortification into existing systems and structures. So we are here to say we are with you, and we're so excited to see this resolution coming to fruition after so many years. Thank you for everyone who has contributed to this.
Thank you so much for your kind words, Vilma. Okay, our lightning round, and it's 1 minute, the parting shot. What one message do you want the participants in today's event to leave here with? I'm going to start with you, Dr. Sylvia Rosen.
I will keep it short so that Papache can take it longer.
Yeah.
It is time. The time has come that we as a society need to take this burden and the responsibility to do something about it. So please, let us look forward to a positive end of this week of the adoption of the WHO resolution.
Absolutely. You're next because I'm saving you for the final parting word. Vilma Tyler.
Yes, I just want to say, oftentimes, in the medical field, we look at treatment. But for us at UNICEF, we say prevention first, and when prevention fails, then treatment comes. So we ask you to come together to prevent the disabilities that are really impacting many women and children. Thank you.
Thank you, Vilma Tyler from UNICEF. And for the last, final, and perhaps most important call to action, Dr. Altman from Turkey.
Thank you so much for your kind words. In order for this to succeed, we need everybody on the table. In order to make progress, we need to be heard, and we need to make sure that we keep human dignity in our thoughts. And thank you so much for supporting this very important resolution. It means great things for my community. Thank you so much.
Thank you so much for this fantastic panel. I just want to have one comment, which I was being told. I see that people are leaving, and I can imagine that we've been talking about nutrition and food during your dinner time. So please be aware that there will be drinks and food after this session being served here. So you can easily stay and enjoy some drinks and foods with us after the session is finished. Fortified, of course. So the final panel of today will look forward. So we all think that, and we know that this resolution will pass this week. But then what's next? And there's two experts that I'm calling on stage now who will talk about the unfinished agenda of food fortification and what still needs to be done in just a few minutes, because we know that we are getting late and we know that we are in the way of your meal. So I would like to call on stage Dr. Homero Martinez. He's the Senior Technical Advisor on Large-Scale Food Fortification of Nutrition International, and he's been one of the founding fathers, I would say, of this resolution, Dr. Homero. And Dr. Lynette Neufeld, she is the Director of Nutrition at the Food and Agriculture Organization of the United Nations. Welcome. So Homero, first over to you. Can you tell us about the unfinished agenda of food fortification and how this resolution can help? Over.
Thank you very much, Saskia, for the introduction. I think that all of us are absolutely convinced about food fortification, and I think that all of us are thinking that by the end of this week, the resolution would have been approved. But as Saskia puts it, what next? What happens the following week? And this is what I would like to stress, the unfinished agenda. We have more countries in the world that do not fortify than the ones who fortify. So we have a task to face. I think that the good news is that by now, we have enough experience out of these many countries who have adopted food fortification as a national policy, mandatory large-scale food fortification, to let us know what works and what doesn't work. In other words, we have a roadmap. We can follow this roadmap. It is not a trial and error that we have to, the approach that we have to follow. So it is important to build up on what we already know. So on the first hand, it will be important for each country to define its own policy. Each country has to own the program, and each country has to adapt the global lessons to the specific context. But some general lessons. We have to understand the extent of the problem. We have to know what is it that people eat, what is it that they are missing, and how much of that is missing in the population, so that we can have a dimension of the intervention. We have to have at least an idea about the impact that it has on the population, and I understand that few countries actually have a good and operating birth defects system, but there are many other ways to approach it. And then we have to select what food to fortify, and in some context, the country will have to be creative. We have heard some very nice examples, for example, from Ethiopia, highlighting how they plan to tackle the way to reach all of their population and not just the ones who may have access to, for example, fortified wheat flour. So a little bit of creativity is in order. And then we have to find the right way to monitor and evaluate the program. So legislation and regulation are at the cornerstone of successful food fortification. And definitely we have heard that this is a safe intervention, but safety for the public is an important reassurance. So food labeling is key, and food labeling cannot be false or misleading. So again, regulation, monitoring, evaluation. We know that we have heard about the importance of partnerships. I cannot stress enough the topic. And again, we have to be creative about the partnerships. Some years back, when we were thinking how to expand our activities, we were thinking who could be the logical partners for this activity, and of course, affecting children, we thought pediatricians would be the logical ones. We haven't thought about neurosurgeons. We're missing the most important driving force that brought us to this, to the drafting of this resolution. So we have to really be creative about the importance of partnerships. We have heard about civil society in its different forms. We have heard about the importance of technical partnerships. And it is important, again, to stress this togetherness. We have to be creative and inclusive in our approach. And I guess that I would really like to stress the message that we have heard before. We have a very, very important and cost-effective solution. I would like just to highlight two numbers. For every $1 invested in fortification, $27 are generated in return from averted disease, improved earnings, and enhanced work productivity. And in this enhanced work productivity, again, I would like to quote an example about the importance of the neurosurgeons. We heard some examples from Ethiopia, who, if I'm right, about 15 years ago, had one neurosurgeon available in the country, and he was about to retire. We have heard they have now about 100 neurosurgeons tending for a large population. If they are successful in their efforts to reach the whole population with effective large-scale food fortification, this will mean saving about 40,000 hours of specialized neurosurgical care. So this is just to give you an idea about the extent of the importance. So finally, to close this, let us not lose sight that there is a large unfinished agenda, and we need to help to address how more countries will contribute to make this resolution an actual success. Thank you, Saskia.
Thank you, Miro. And now over to Lynette for your thoughts about the unfinished agenda of large-scale food fortification.
Thanks. Thanks, Saskia, and thanks to everyone for a very, very intense and very lively set of discussions. It has indeed been a full agenda, which you promised, which has been great. Importantly, we've heard the perspectives of the implications of this resolution, not only for countries, but for communities and households and the lives of individuals. And I think my first call in terms of the way forward is to never lose the messages that this isn't just about a resolution, and this isn't just about a national policy, but it is about something that means all the difference to the lives of individuals and communities. This is an incredibly valuable reminder because micronutrient deficiencies are rarely visible, as we've heard. That's why they're referred to as hidden hunger. And we far too easily forget the devastating human consequences of all forms of micronutrient malnutrition. One of the important findings of the paper that we published earlier this year that Lawrence mentioned during his comments is that this is not an isolated issue. This isn't a problem that you find in a region of the world or in just a few countries around the world. Every single region of the world is affected, including high-income countries. Micronutrient malnutrition, sadly, exists everywhere. And with that in mind, there's an enormous agenda that we must push forward to prevent all forms of malnutrition, including micronutrient malnutrition, but all other forms as well, and their related health consequences. And that is concerted, strong efforts to promote access and availability and to healthy diets for all people everywhere. There is so much that we need to do in this regard, and there is an enormous amount of momentum currently in the follow-up, all of the actions that are follow-up to the Food System Summit that happened in 2021. But even under the best scenario of access to healthy diets for all, there are several nutrients in several contexts that are not provided even by healthy diets. We've heard some of those, And the role of food fortification is fundamental in this context. Just let me talk you through those three scenarios. First is the case where soils or other aspects of food production, even if foods are available and accessible and affordable, simply those foods do not contain enough of the nutrients. That's the classic case of iodine. There are parts of the world where iodine is just not present in the food, and we must increase iodine in the food supply. The second scenario relates more to the specific needs of high-risk populations and the need to ensure that our food supply goes above and beyond just the minimum requirements to provide the needs for those populations. And that's the case that we hear about related to folic acid requirements for pregnant women and all of the implications of prevention of neural tube defects and other forms of congenital anomalies. And finally, unfortunately, there is still an enormous gap in the world, in many countries around the world, in that access to healthy diets. And simultaneously while we act to change that, we cannot lose that agenda as our goal. But in the meantime, there are many populations whose need for iron, vitamin A, zinc, vitamin D, vitamin B12, and many other nutrients is not met. The nutrients are not sufficiently available in the food supply that is accessible to all populations. And there is an incredibly important role for fortification across all of these scenarios. The resolution under discussion this week provides the fundamental grounds for commitment to action. Fortification is not a substitute for diverse, healthy diets. But fortification and fortified foods are part of a healthy diet in context under those three scenarios that I mentioned. And we urgently need to spur on the actions to ensure access across contexts. So congratulations to all of you, those of you who have been working on this resolution and brought it here to WHA. Many of us have been in this room, have been working on fortification for longer than we might like to mention. And the reality is that this is the kind of action and the commitment that we need to go that last step and to make it a reality in the context where it's needed. Thank you very much.
Thank you very much for giving these perspectives and for the two final panelists of today. And thank you very much for reminding us that, you know, we have been talking about large-scale food fortification as part of this resolution, and it's one of the more technical solutions to combat micronutrient deficiencies. But more importantly, all of this is affecting the lives and the future of millions of people and pregnant women and their children around the world, and we should not forget about this. So yes, we are not yet there. This week marks an important start, and it's time. I think it's also a moment to celebrate. But it is important that we realize that we have to embed it in other interventions or in national policies, and that it is not the holy grail, and that there are challenges ahead of us. But at the same time, I think there are countries that have been present here tonight that have shown that it is possible to do this in an integrated way and to affect the lives and future of these women and children. So let's not forget about that. And I would like to thank those countries that have been instrumental in bringing this resolution forward, in particular the governments of Colombia, of Ecuador, and of Malaysia, and the other countries that were present here today that have been really leading the way. So I would like to ask you, when we bring this forward this week and also after this week, to make sure that that more member states come up and support this resolution, to make sure that you mention this resolution and large-scale food fortification in your final statements that are submitted for the official records, because then it will be highlighted even more. To also take action to strengthen your programs on national food fortification, and preferably embed them in national nutrition and micronutrient policies. And looking ahead to the first moment when you can reflect on this, maybe at the Micronutrient Forum conference, which will happen this year in October. You're all welcome to join us there. But also next year at the World Health Assembly meeting in May next year. And then maybe even consider including this large-scale food fortification and micronutrient policies As part of your commitments to the next Nutrition for Growth Summit that will be held in Paris in 2024 or maybe early 2025, and bring this further forward. And yeah, with this, I would like to close this session. I would like to thank you very much for being present here and for supporting us this week, and for all your work that you do to support the prevention of micronutrient deficiencies and folic acid through large-scale food fortification and other interventions. And I would like to again emphasize that there are still drinks and foods, more importantly, available. Oh, and a surprise as well. And what I wanted to say is that it was really a unique effort to work together, coming from the micronutrient nutrition silo, to work together with food, health, neurosurgeons, and patients this time. And I think that was really why this was such a special effort and why it was so successful in the end. So we should do that more.
Right, with that we close. Please join us to enjoy this unbelievable view that we have and to share fellowship. What a wonderful world it would be if we can pass this resolution. Thank you.